Hi guys, you're back? Great. I didn't scare you off last time. I was a little bit concerned about that. But you're here, you're back. So we're gonna get going on the other video that I promised you that I was gonna go. I said I was gonna do what not to say. That one's pretty quick. And this is because I've heard bar medical graduates being told, well, when you go in there, and if you can't speak English that well, or English is not your first language, the standardized patient at SP, they'll understand. You just have to tell them, my English is not so good, and so therefore bear with me. I've actually heard that said. I actually have heard it said by people who are very well-meaning. So don't get me wrong, they are well-meaning. However, please don't do that. Please don't go into the patient, the standardized patient, and say English is not your first language. Bear with me. Please understand. My understanding is from the booklet, the USMLE booklet that they have online, which I read from cover to cover, and I continued to read while I was doing Step 2 CS. You pretty much then failed the exam. Now let me explain why. So this video is what not to say, like what not to wear, this is what not to say. The reason why it would be unwise to say my English is not so good is that there are three major factors that they're testing for this exam. They're testing your spoken English proficiency, that's number one. They are testing your communication and interpersonal skills, that's number two. And they are testing the integrated clinical encounter, which involves your interaction with the patient and the patient note. So if your exam, our exam, is divided into three: spoken English proficiency and communication and interpersonal skills make up 2/3. And with this exam, you have to pass all of them, but those two make up 2/3. When you go and you tell them, you're testing me on spoken English proficiency and communication skills, and I'm going to tell you right off the bat that I don't speak English well, what's the point of the encounter? You see what I mean? So it may sound kind of humble, it may sound sensible, but it's not. If you go to take a driver's test, you don't go to the driving tester, the examiner, and say, oh, well, you know what, I really don't know how to drive very well, but let's go do this. I mean, the whole point of the test is to test whether you speak English well, if you communicate well. So if you say to them, I don't speak English well, you're shooting yourself in the foot. And based on what their booklet says on the website, you're going to have failed that encounter. So this is a pretty short video. Please just don't say I don't speak English well. Oh, I don't feel comfortable. Oh my gosh, I'm so nervous. I've just come to the United States and this is all so scary for me. It may seem as if you're trying to get them to be empathetic, and that's not what the exam is about. The exam is about testing whether you are confident, whether you can speak English proficiently, whether you have good communication and interpersonal skills. 2/3 of the exam is made up of that. What not to say as well is, do you think I've passed this encounter, or are you going to mark me? I know this sounds very, very weird, but people do crazy things when they're scared. And you don't want to come off as scared, needy, desperate, any of those things. What not to say also is, you don't want to use too many big words, or at least I tried not to use many big words. I tried to break things down. And as I was telling some other friends of mine who are going to be sitting the exam this week, I didn't give the SP any opportunity to say, what does that mean? What does that mean? What does that mean? Because based on what I read in the booklet, based on what I've read in the booklet, they want to find out, are you the type of doctor, are you the person we can send to work in a clinic by yourself, and patients understand you, they understand your plan, they understand the diagnosis, they understand what is happening to them based on what you understand, and have you communicated that well? So if you use big words like bronchoscopy, even if I were to say bronchoscopy, I would quickly follow that up by saying, we're going to pass a tube into your ear tubes, we're going to pass a tube into your the windpipe, and we're going to have a look around. So I found myself not using words like bronchoscopy or endoscopy. No, I would use, and I would break it down. And I was a part of an organization at home medically, the medical practitioners. And I remember that the PR people would always tell us to communicate, if you're communicating to the public, communicate so that a 12-year-old would be able to understand. That's not to say that you are saying that your audience or your patient is foolish. Basically, you want to make sure that they understand you. If a 12-year-old can understand you, then they can understand you. So bronchoscopy, no. Thoracocentesis, no. You just say, we want to take some fluid from out of your chest. Or I'd like to be able to take a sample of the fluid from your knee. You can say things like that without having to say joint aspiration. And then you're going to have to turn around and explain it. So rather than say joint aspiration then explain, always break it down. I tried never to use words. Now when you get to the patient, no, you can joint aspiration all you like, thoracocentesis all you like, bronchoscopy all you like, but when you're in front of the patient, please limit the number of words. I would say just don't use any words. This is my recommendation anyway. That has to be explained. And if you do, explain quickly. Don't get to the point where the patient is saying to you often, what do you mean by that word? What did you mean by that diagnosis? What did you mean by this? What did you mean by that? What do you mean by pancreatitis? What do you mean by... If they keep saying that, that means your communication and interpersonal skills is not that great. That's the whole point of the encounter. The whole point of the encounter is to get to the point where when they leave you, they are comfortable. They understand what you're thinking. They understand that you have a number of things that you're thinking could be wrong. They understand what you're going to do about that situation. And so that's what I would say about what not to say. And I'm going to talk more about that in the other videos. But the other one I want to get onto is the other video that is really important. How we lead in to the patient encounter. What do I say when you step into the door? And how do you open up the flow of conversation so that you start the encounter right and on the right footing, so that you can get to the point. All right, so I'm so glad that you're back, and I'll see you in my next video. Bye.